Hey guys, Dr. Matt here. Thank you for tuning into this video. And in this video, it's the part 2 of lumbar exercises and stretches that you can do for people that have chronic low back issues. Now, in this video, I'm going to be showing you guys some more of the technically more advanced stretches that people that can do that primarily for those that have really that irritating sciatica pain. And that's typically, people that are active and they go to the gym, they lift weights, or they're runners and they like to run, and then that sciatic pain that goes down here, and it seems to be irritating for most of the time, and these exercises will hopefully help keep the low back maintained as well as getting adjusted and going to your chiropractor. So let me know how you guys are doing with these, and again, always consult your physician or a spine specialist if you have any type of degeneration, stenosis, and those sorts of things, or a hernia, before you start doing any physical activity or deep stretches, because definitely need to get that checked out. So the first thing that we're wanting to do is open up the hips, and we got to take care of the muscle called the piriformis muscle. Now that one is the one that lies directly over the sciatic nerve and causes a lot of people a lot of issues with sciatica and those types of pains that are unrelated to a disc. So the first thing we're going to do is open our hips with a cross, like open hip flexor stretch. Now, like the other video, it's about the same thing. What you want to do is take the opposite leg, bring this one down, and just pull it over, and take your hand on this side and just lift it up and pull back. And this should open up the hip flexors here, and hold it for about 20 to 30 seconds. And do it at least twice on each side. And then you want to switch. See how I lean the other opposite way over here? The next thing is we're going to be stretching the long abductor muscles, and that's also part that can be pulling on the low back and causing some issues with sciatica. Do these also if you're a runner or you're about to lift weights. Do these exercises before and after, and you should get some relief from it. So you're going to open up your legs here, and then just bend at the waist down, and then go as far as you can. I'm not that flexible, and just hold it there for about 10 to 15 seconds. So now we're going to do the short head of the abductors, and that's bringing your legs in and just pushing them down. And that should help open up the groin as well. You want to keep your back nice and straight and hold it there for like 15 to 20 seconds. Just like that. Now, one of the things that I think is the best way to stretch the piriformis muscle and to open it up is called the table piriformis figure 4 stretch. So you want to find a hard surface like a bench or something that's a little rows up that you can actually set your leg on. And I want you to do this exercise, hold it there for 20 seconds, and it starts just like this. You want to take your leg, put it in front of you, bend it like that, and then I want you to keep your back straight and lean into it just like this, and then lean back. And this stretches the whole piriformis on this side, back here. You want to keep it straight and then just lean into it. Hold it there for 30 seconds. Sometimes you can put your hands on your hips as you do it. They can help. So you want to push it back and then lean into it just like this. Now, the second way you can do this is you can lay on the floor or on a table or something, and it's called the figure 4. So what you want to do is take one ankle, put it over here, and then take the other one and try to bring it up toward your face. Just like that, and hold it there for about 20 seconds as well. Switch. See how my leg makes a figure 4? Hold it there. The next one you can lay on your side, and they're called the hip extensions. So what you want to do is just open your hip and just hold it there for about 10 to 15 seconds, and then leg extensions. So you go up just like this. You can do this on the floor, and then take your other leg and just lift it up and hold it there. as you're doing this, you want to keep your head straight, like look up as you're just trying to, like you're trying to fly like Superman. And hold it each pose for about 20 to 30 seconds. And do this around 2 to 3 times. So a combination of all those exercises and stretches should help relieve some of those piriformis syndromes and that sciatic pain that might be associated with it. So the next thing that we're going to do are going to be a couple exercises that help with the psoas muscle, and that's right here in this area to stretch it. So the first one is the most easy and the one that if you feel uncomfortable, just start with this one, and it's just the leg drop. So again, you want to find a table or a bench, lay down face up, and then take this side, go to the corner as you keep this leg up, and then just let that leg kind of droop down and hang so it stretches here, right there. And do that around 15 seconds, about 2 or 3 times. The next one is the kind of the kneel or the lean. You do this on the floor, but I'm going to do it on the table so you can see. And do this for about 2 to 15 seconds each. Basically, taking this foot, putting it here, and then taking that far, drop it back, keep this leg straight, and just lean into this one. And that's, start to stretch all of this in here. That's where the psoas is. You want to lean away to it from it as well. Just really go deep into that. And that stretches the psoas. And you want to do that at least 2 or 3 times. Let's see here. Let's do this one now. So here, lean into it, and then lean away, just like that. See how it's stretching here. About 10 to 15 seconds, hold it, and do it about 2 or 3 times. Should start opening up the psoas muscle and starts, getting some of that lumbar extension. So once we finish with all the stretching and you feel like you're nice and loose, then I would like to incorporate some core muscle strengthening. And basically, I just, there's a lot of them out there, and I just kind of pick the most basic ones that anyone can do at home and help build that core strength. So the first thing is obviously the plank. So as the other video, planking is keeping this part as flat as possible, and easier if you look up and do it. So you want to do this and hold it. And then go to cross crawl or bird dog, and then you could do same side, and then do opposite sides. This leg, left leg, switch. Do that 3 times 15 reps. If you want to make it more challenging, you can bring it down, touch, come back out. Next thing are the side planks. Hold those for 30 seconds. And these are side planks. You want to keep your hips up and make sure everything's flat. And hold that 10 to 15 seconds as well. Do both sides. And last thing that we want to think about whenever we're doing these are the abs. So typically if you have lumbar stenosis or degeneration in a disc, doing actual sit-ups is not recommended because it puts a lot of pressure on those discs. And we don't want to do that. So a good alternative to doing sit-ups are called 6 inches. So, and it's on the legs. Lay flat. And just lift your legs up 6 inches. You can hold it there. And do that for about 30 seconds each time, and it activates all the abs. If you want to make it more challenging, you can do frog kicks, and it helps strengthen up the abs. This next one is called the sciatic nerve flossing exercise. And what this does is it actually takes the sciatic nerve and where it connects from L4 and L5 and kind of slides it through the fascia and all those spots that it might be stuck at. And this should definitely help with that chronic sciatic pain that comes out of nowhere. So it's pretty simple. Find somewhere to sit. Make sure your legs are up nice and hanging. And then what you want to do is, as you tuck your head down, you take the left or right leg, whichever one you're going to be using, and you bring it down with you. And then you curl your shoulders up. And then as you do that, you want to lift your head back up, extend your legs, extend your back, arch your back, come back down. And you want to do this at least 15 to 20 times each side. And then you want to really hold that arch and push that leg out. Now, this is another flossing exercise, and this is for the myofascia and everything around all the lumbars, and helps loosen everything up. So this, in combination with the sciatic flossing exercise, should help a lot with those chronic low back issues. And there's just 3 steps to it, and each step you want to hold that position for 20 seconds at a time, and start with doing it at least 3 times a day. So first one, it's the basic knee to chest, and what we're going to do is just bring our knees up, hold it there for about 20 seconds, and then we're going to just extend our knees all the way up as high as you can, hold that for 20 seconds, and then open and do that, and then come back to neutral. Really flex your spine, up and out, and hold each position for 20 seconds. Come back down. So, in combination with doing the exercises, the stretching, the core work, and the flossing maneuvers, it should help with those people that are active and want a little extra movement and actually do more to help with that low back issue. So again, the part 1 was about those people that are just starting out, that have had chronic severe lumbar stenosis and are just recovering from a hernia, anything like that. Definitely start baby steps, but hopefully you guys will be able to jump right into this as well. Don't forget to subscribe to the video so you can see what else is about to come up, and please hit the like button. I appreciate everyone for watching, and everyone stay active and healthy.